Okay, let's get started. Hi guys, sorry I missed the red carpet rollout. Really glad that you guys could come. By now you have heard from Sheila, who has told you why it was necessary to switch from a medical diagnosis designed curriculum to a concept-based curriculum. My job is to kind of give you just a little taste of what it would be like to actually teach and learn in a concept-based curriculum. And so we're going to get started. I just want to say that at this point, hopefully Laura and Sheila will hand out this worksheet that I have provided them with. And so while they're walking around the room, I'm just going to talk a little bit, grab my notes here. So I'm going to not necessarily be your teacher, but your facilitator. And what I want to do is try to help you realize how teaching in a concept-based curriculum could avoid, hopefully, repetition and avoid content saturation as much as possible. The actual worksheet that I just handed you guys is an example of a worksheet that I would provide my students with when they were listening to one of my videos. I like to do videos on the main idea, which we're going to cover in a lecture, and then they bring that worksheet in. And we can go over it. I have time then to answer any questions that they might have about the concept or the idea. And then we can actually spend more time in the classroom instead of me lecturing, working on ideas or concepts and working on exemplars, what we call exemplars. Okay, so let's go ahead and get started. I have a question for you guys. And the question is, what does hypertension, let's say MI, and PAD, or peripheral arterial disease, all have in common? So if you think about those three particular things, I want you to think about what they have in common. Could it be risk factors, complications, treatments, diagnostic testing, even the physiology of what's happening? So at this point, Laura is going to go ahead and pause the video, and she's going to give you a chance to actually write down your thoughts and then restart the video. Okay? So Laura, you want to go ahead and pause the video? All right, guys. So my question is, when you were writing down your thoughts about hypertension, MI, and peripheral arterial disease, what were some of those thoughts? Hopefully, some of the thoughts were, okay, we have an issue with perfusion, okay, that we have maybe a decrease in perfusion, or maybe you thought about cardiac output and the fact that we have a decrease in cardiac output. Maybe you thought about there would be certain assessment techniques that you would use for these individuals, or that maybe some of the things that you discovered as far as assessment abnormalities would be the same. So maybe there would be some assessment abnormalities that would be the same. Maybe you thought about some of the diagnostic testing could be the same for these guys. Or maybe, excuse me, you thought about some of the risk factors for these three particular ideas could be the same. But when I think about what does hypertension and what does MI and what does PAD have in common, I think about perfusion. And that's what we're going to focus on today. We're going to focus on the concept of perfusion. Because when you look at perfusion, so many things that we teach in nursing school actually deal with, or the main idea or thread is perfusion. So what we're going to do is we're going to discuss perfusion, develop it oh so little, because we only have like 15 minutes and I've already used 4 minutes and 30 seconds just getting to our idea for the day. So, but we're going to talk about the concept of perfusion. Okay? Now, so if I was going to teach the concept of perfusion to my nursing students, then the first thing that I would need to start with would be physiology, right? What's going on? Now listen, you could get really in-depth with the physiology of perfusion, but for the sake of time, we're going to keep it very simple, and we're going to say what perfusion is. And perfusion is just the blood flow, right, through the arteries. We need that blood flow through the arteries, okay? And the reason we need the blood flow through the arteries is so the organs and the tissues can get the oxygen and nutrients, right, that they need in order to survive, right? But then also we need for the waste products, right, to be carried away. And so, like I said, that's keeping it pretty simple, right? Now, this certainly would be a time that we would want to address the fact that we have what we consider central perfusion, perfusion of what are the necessary organs, or what we have tissue perfusion, okay? So we certainly would want to take a second because these are a little bit different and just outline for our students what is central perfusion versus tissue perfusion, okay? And like I said, this is very brief physiology for perfusion. Then what we could do is that we could ask the students, okay, and hopefully you guys are writing down on your handout that I gave you. If you had a disruption in perfusion, what could be some of the things that you might see in that particular patient? It'd be really important at this point that we would talk to the students about some of the medical terminology that they might see, medical terminology that they're supposed to have learned in the first semester of the curriculum, but making sure, you know, we're doing a reality check, we're doing a knowledge check here, guys, making sure that they understand. So, for instance, if we had decreased perfusion, decreased cardiac, first thing we're thinking about is hypotension. Let's make sure that they can actually define and know what hypotension is. Someone with perfusion issues a lot of times actually suffer from orthostatic hypotension. Hey, do they know how to actually take orthostatic measurements? Let's check that. This would be a time that we could talk to them about what murmurs are, right? Murmurs certainly could cause a decrease in perfusion, and heart defects, congenital heart defects, actually fall under perfusion. Could be, we want to make sure that they understand what tachycardia is, the definition of tachycardia. Dysrhythmias certainly follow under perfusion, so we'd want to make sure that they understand dysrhythmias. And then the last couple of things that I have listed on your worksheet is we want to make sure they understand the difference between ischemia versus infarct. So this would be that time we do physiology, maybe on a video, and then we actually, after the physiology, we just do a reality check. Do you guys know these key terms that you're going to run across again and again when we're talking about perfusion, okay? So, we need to then, let me just erase here, we need to actually teach about risk factors, don't we? So next, I probably would go ahead and just identify or discuss some common risk factors for people who have issues with perfusion. Now, we have those that which we always consider are non-modifiable. You guys know that. It's the same old, right? Your age, your gender, and your genetics. And then we have genetics, and then we have risk factors. And if you stop and think about modifiable risk factors for people who suffer from perfusion issues, what are some of those that you would actually throw out at this point? I think of the key ones. I think about smoking, certainly. Is that not a risk factor for PAD and for MI, right? I think about lifestyle, you know, from the standpoint, are they sedentary? I think about stress. I think about diet. I think about obesity. When you think about hypertension, you know, you're thinking about obesity. I think about the fact that for an MI and peripheral arterial disease, hypertension is actually a risk factor. Diabetes is a risk factor. It goes on and on and on. You guys know this, but this is where we would actually take the time to identify those and then work those up in the classroom and talk about, for instance, if someone is smoking. How could we help that individual stop smoking? If someone is obese, what are some exercise, or what does the American Heart Association say about exercise and how often and how much? Or diet. What's the diet that we need for someone, for instance, that has a history of atherosclerosis and has the potential to have an MI or had an MI? What's the diet for someone with PAD? What's the diet for someone who has hypertension? And this would be the time that we would actually do that. So we would go over risk factors, all right? So we've gone over, the physiology, we've gone over some key terms, we've gone over the risk factors, and so we need to then start to talk about assessment. We need to ask our students, if you have someone who has perfusion issues, okay, and you're going to go in and you're going to assess them, or the physician's going to actually order diagnostics, what is it that we're going to do, okay? So we're going to actually talk about, let's do assessment techniques. That's what I have on my notes next. Let's do assessment techniques. If you have a student, let's say some of you clinical faculty have a student, you have a patient that you know has perfusion issues, what are some assessment techniques that you would want to make sure that they include, right? So think about that. When I think about central perfusion, I think about cardiac output, and I tell my students, hey, that starts the minute you walk in the door. Is your patient awake and alert? If they are, it takes a certain amount of cardiac output to have a normal CPP, right? So, and then what are their vital signs? What's their blood pressure, their heart rate look like? What's their pulses? What's their skin look like? Do they have a murmur? Are they peeing? These are all things that we tell our student actually help us know if they have adequate cardiac output, adequate perfusion. But then when we talk about tissue perfusion, we go back to the fact of the 6 Ps. I always tell them, if they've had some kind of diagnostic where they've had to cannulate an artery, for instance, we want to make sure that extremity is not going to fall off. And we go over and make sure that they understand how to check for adequate tissue perfusion, or the 6 Ps. Okay? So, as you can see on your worksheet, this would be a time in class where we would actually go over the assessment techniques for central versus tissue perfusion. All right? So then, let's talk about diagnostics. If you had someone who has a perfusion issue and they needed some diagnostics, they needed a workup, what do you feel like would be ordered? Again, let's just take a few minutes, okay, and have Laura or Sheila go ahead and stop the tape for a couple of minutes and write or jot down some of your ideas as far as perfusion. Alrighty? While you do that, I'm stepping over here, getting a drink of water. All right, guys. So, hopefully, some of the things that you guys thought about when you're thinking about diagnostics for someone who has perfusion issues, I think of EKG, I think of a stress test, I think of blood work, I think maybe some ABGs. How about, we probably need a lipid panel. Cardiac markers, right? Markers, enzymes, whatever you guys want to call them. What are we missing? I wish I could hear you guys. I have BNP, because heart failure is certainly a perfusion issue. Echo, I'm thinking about heart failure, I'm thinking echo, chest x-ray. And you guys can kind of see, when you think about someone who's going to be worked up for an MI, you can see which ones we would choose. Someone who has a history of hypertension, many of the same diagnostics would be ordered, peripheral arterial disease. And then if we wanted to go a little bit more invasive, then you have your actual cardiac cath procedures, right? Or interventional radiology, right? possible revascularization procedure, possible balloon and stenting. And you can see how when we talk about that, MI and PAD, we would essentially be teaching the same thing. And so that's the diagnostics, all right? So that brings us to our last point, and I'm looking here and I'm already at 15 minutes, and Laura and Sheila are probably saying, you need to wrap it up. And you guys are probably ready for me to wrap it up. But the last thing then that we would actually want to cover in depth would be, how are we taking care of this patient, okay? How are we taking care of this patient who has a perfusion issue? And then, you know, we could break it into independent or nursing interventions, right? Versus collaborative, okay? And so then we would spend a significant amount of time actually developing nursing interventions versus collaborative efforts. And you guys can see then the student would finish listening to the video and would actually, I could tell them to look through their book, I could tell them to finish the video, write down, you know, what I've said as far as nursing interventions versus collaborative, and then we would bring that into the classroom and we would discuss that. This is certainly where we would bring in pharm, right? And if you think about for pharm, you know, you're talking about hypertension, you're talking about beta blockers, you're talking about calcium channel blockers, ARBs, alpha vasodilators, nitrates, diuretics, etc. For MI, you're talking about many of the same things. We have found that beta blockers are useful for MIs, ACE inhibitors are useful for MIs. You would, for instance, with peripheral arterial disease, for all of these, there would be, you know, some anticoagulation therapy that would need to be introduced. We would introduce that. So you could see that they would learn what would seem like a significant amount of medications, but then as they came across perfusion issues, we would just say, okay, refer back to this lecture where you've already learned all these different medications. So that brings us back to the first question, and I asked you guys, what is MI, hypertension, and peripheral arterial disease have in common? And now we understand that they mainly have a perfusion issue. And so if we can teach the concept of perfusion very in depth, not just for, now we're on 17 minutes and 45 seconds, but in depth, and then just bring out the differences in some of the exemplars like MI, hypertension, pulmonary arterial disease. Why wouldn't you do that? It gives the student a better understanding of the underlying problem, and then if they face a question on board and they can identify it as a perfusion issue, but they don't remember the specifics to that particular medical diagnosis, they're going to be more successful in answering that question. So that kind of wraps it up. I hope that you have enjoyed this little mini session. I'm going to turn the presentation over to Laura now. Laura's going to do a couple of things. I have another handout for you, a handout that possibly I would give students that would say, hey, here are these 3 exemplars. These are the things that are the same, and these are the things that are different that we would need to learn new. And you can kind of see how minimal it would be. So anyway, thank you guys for listening. I'm going to turn this over to Laura. Laura's going to give you my final handout, and she's actually going to do an activity that sounds quite fun. So listen, you guys enjoy the rest of the red carpet rollout, and thank you for coming.